So welcome everyone. In this video, we are talking about PMS and PMDD. And if you want to learn how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal, a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry, an online mental health practice in California. We see adults with anxiety, depression, and sleep issues, and we also provide nutrition services for mental health. So today I'm joined by Dr. Cheruba Prabakar. She's a board-certified OBGYN and a fellowship-trained minimally invasive surgeon. She's the founder of La Marinda Gynecology and Surgery in Lafayette, California, where she treats a wide variety of gynecological conditions. She's also known as the fibroid doc, as she has a special interest in taking care of women with fibroids. So welcome, Dr. Cheruba, today.
Thank you so much for having me. This is exciting.
Yeah, I'm really excited to talk about this topic of PMS and PMDD. And as we were just discussing before we started recording, this is a pretty widespread issue. And even in the past week, I've seen quite a few women coming to me for the mental health aspect of these conditions. So maybe we can start by just understanding a little bit more about what is PMS and what is PMDD and what's the difference between the two.
Great. So PMS is premenstrual syndrome and PMDD is premenstrual dysphoric disorder. So many women around the time of the period or right even before it, like a few days prior, will start to get maybe a little moody, may sometimes have anger, sadness. Some people, feel like they're depressed, food cravings, cramping, bloating, trouble sleeping, all of these kinds of symptoms that can lead up to the period. And then they go through their period with some of these symptoms. And then as the period ends, they start to come out of the fog and get back to normal, so to speak. And so some of these symptoms can be grouped as premenstrual syndrome. And this can be, mild for many women. I think almost all women go through some sort of this form of this, but then for other women, it can be pretty debilitating. And then when it gets really debilitating to the point where it is impacting their lives, like they need to call out of work or school, they need to take a week off before their period, then it starts to become this serious, more serious thing. And we term that PMDD or dysphoric disorder, where all of these symptoms are just intensified to the point where you can't just brush it off with a little Motrin and a little exercise. Now you're going to really seek professional help or have to take time off to really deal with it. So that's how I think about the two.
That's a really helpful distinction, and especially just noting that these symptoms can indeed be debilitating. And one of the patients I was working with yesterday, we even talked about maybe even taking a day or two off of work around that time because it is having such a significant impact. So can you share more about that, and how do you see these symptoms showing up in your patients?
Yeah, so they're very variable. For some, it's physical symptoms, and then for some, it's emotional and psychological symptoms. So physical symptoms, pain, cramping, bloating. The cramping is one that's pretty severe. Some patients will have to put like a warming blanket, like a heating blanket. And some patients literally tell me they're curled up in a fetal position, like for several hours, with the Motrin and the heating blanket. So these patients are definitely having to take time off of work. And I'm often writing notes for these patients because it's a cyclical thing and it's really affecting their quality of work. Like they can't even be at work. Excuse me. For other patients, it is that intense feeling of sadness or tearfulness. And for others, it's anger. I mean, a patient told me a couple months ago, she was 16, that she would just start throwing things. And her parents brought her in because, she was breaking things in the house. And it passes after those 7 to 10 days, but it's so intense that they were like, well, something needs to be done. So it can manifest in a variety of ways. But these are some of the more, the stories that really stand out to me.
Yeah, those are really compelling stories. And I think one of the questions I get asked a lot is like, what is actually happening? Like, what is happening with women's hormones during these times? So could you share a little bit about that? Like, what's going on with these hormone fluctuations?
Yes. And this is, our bodies are amazing and so complex. And when it comes to women's health and hormones, it is like a Pandora's box, right? There's so many things that are going on with the two major hormones, estrogen and progesterone, that control a lot of our bodily functions, our mood, our overall health as women. And during the cycle, estrogen and progesterone are in varying levels, depending on when in the cycle you're talking about. But closer to your period or the week before your period, the body's realized, oh, okay, this egg that I just ovulated is not being fertilized. I'm not going to have a baby. That this body is not getting pregnant, and the hormone levels start to drop. Estrogen and progesterone start to drop, and then eventually the lining sloughs off, and that's when you get a period. So this dropping of estrogen is what can be pretty significant for many women. For some, it's dealable, right? They can just take a little bit of something, or maybe a supplement or hormone supplement and keep moving. But for others, this can really affect them. So it is that acute drop of estrogen in that last week, right before the period, is what we're really talking about.
Okay, that's really helpful to know. And so I know people have questions about hormonal treatments and non-hormonal treatments, so we can talk a little bit about those. And, in our practice, we're an integrative psychiatry practice. So our approach is always to start with more natural lifestyle interventions and then go into more biochemical interventions later on. So can you tell us a bit about what your approach would be to a patient who comes to you with PMS or PMDD?
Yes. So the first thing I encourage young girls, teens, women to do is just have some sort of a diary, every month, what's going on, and is this a repetitive pattern? Sometimes it can be just a one-off cycle that's really bad, but if this is happening every single month, where you can sort of almost predict, oh, okay, but by tomorrow I'm going to start feeling this way, then that helps just to organize your life and kind of the activities that you're going to do. So I do suggest exercise as the first thing, just getting outdoors and just breathing in the fresh air, going for a brisk walk, a run. And believe it or not, exercise actually really helps during this time. I remember in high school when I was in the tennis team, every time I'd get my period, I'd try to just get off of tennis practice, and I'd tell my coach, oh my gosh, I have my period. And he's like, well, perfect timing. Like, it's time to get the exercise going. And it always stuck in my mind, but that is so true. Just the way the prostaglandins work, and just, the interplay of the environment and the mood really help with just feeling better. So exercise is one. And despite a lot of cravings that many women have, like chocolate and chips and all of that, trying to really stay balanced by preparing those meals ahead of time. So lots of vegetables, lots of fruits and protein. And then, indulge in some chocolate or cookies, but try not to make that like an excuse, almost like, oh, I'm it's my time of the month and I'm just going to start eating all these junk foods, because that can actually do the opposite and make you even feel worse. I also like essential oils, so things like lavender, especially just even taking a little bit and rubbing it in the lower part of the abdomen, kind of on your temples, can really just help elevate mood. And then making sure you sleep enough. So these are some of the core things that I would say in terms of lifestyle. And then if you're doing all of these things and then you just need a little bit more for maybe cramping or bloating, I would add on like an anti-inflammatory, like an Aleve or Motrin, Advil, one of those medications with food. And that can just help take away the physical symptoms so that you can actually focus on your mood a little bit and the things that you need to do. And that is enough for a lot of people. Now, if you're if you're one that is really starting to go along the dysphoric disorder spectrum, where you're throwing things, you're angry, you're like a different person, and you're having to take that whole week off of work or school, then at that time, I would recommend some hormonal treatments, like even a simple birth control pill, because what that does is prevent that acute dropping of the estrogen and really keeps your hormones at a very stable level. And we can achieve this by very, very tiny amounts of hormonal medication and very low dose birth control pills. So that's something that I would talk to your gynecologist about.
That's really, really helpful, and a great point about exercise, because that's sometimes the last thing you want to do when you're experiencing some of these symptoms. But even just like you said, getting outside, getting fresh air, bright light, going for a walk can make all the difference. And so I'm curious, do you recommend any apps for tracking, or how do you suggest to your patients to track their symptoms?
Yeah, there's so many apps out there, but I just like plain like a little notebook that has, what you're really feeling. I find that sometimes with the apps, there's so many things to input, so many parameters versus you just writing down what it is you're feeling, and in your own words versus having to qualify them by these other parameters that the app has. So I tell patients just to write it down.
Great. Yeah, that's great. That's kind of my approach as well, especially like we see a lot of patients with sleep issues. And I like the old-fashioned pencil and paper method to track sleep, because like you said, some of these apps and tracking devices can be more stressful than they need to be.
Yes, exactly. How did I enter it in today? I forgot. How was I feeling? Versus just, okay, everything was good, except, during my period, I felt this and this month. And it's just simpler to read. And it's easier for me to also understand when patients are narrating that information back to me rather than just sending a big chart full of different colors.
Absolutely. And I'm curious as well. So you mentioned lavender oil, and I love that. I love that you're bringing essential oils, and there's a lot of evidence for lavender for its use in sleep issues, for anxiety disorders, and so forth. Are there any other essential oils, natural remedies, herb supplements that you sometimes recommend for PMDD?
Not at this moment. I am, believe it or not, introducing a more formal essential oil component to my practice. I'm actually taking a course on this. So we are playing around with a few different oils, but at the moment, lavender is the one that I really do recommend either as an oil or even as a pillow mist that can help with just sleep and calming yourself down. But really, just focusing on healthy foods. I know that there are a lot of South Asian herbs and spices that I know I use in my cooking that specifically can also help, including turmeric. They're not, I wouldn't say there are big studies that show just yet in terms of PMDD, but I know for general health, these are helpful as well. I know a lot of my patients take turmeric capsules. So I just tell them, hey, instead of doing that, just try to incorporate it a little bit with your food. And that just helps for better digestion and absorption into your body.
Wonderful. Yeah, that's a great point as well. Using these herbs and spices medicinally, because traditionally that's how they have been used in Ayurveda and traditional Chinese medicine and things like this. And I've seen amazing results with turmeric for my patients who have pain and inflammation.
Yes.
Even just using it dietarily makes a big difference.
Yes. Fenugreek is also another one, although the smell can be quite pungent.
Yeah, and just a little bit goes a long way.
Yes.
Yeah, absolutely. So, one thing that we like to do in our practice as well is lab work, checking iron levels, especially if there's heavy bleeding. Sometimes we'll look at vitamin levels like vitamin B. Sometimes when people are on hormonal birth control, it can start to deplete some of the B vitamins like vitamin B6. So these are some things that we like to look at. What sorts of blood tests or investigations might you recommend for a patient coming to you?
Yeah, the basic one is just a blood count, just to see what's happening with their bleeding. The two other ones that I focus on are thyroid and prolactin. Especially in younger populations, the prolactin has surprisingly been off sometimes, and that can explain bleeding and also some of the intensity with which some of these symptoms are experienced. Estrogen and progesterone are not always the most accurate just because of where you're in your cycle, and it can really differ. But making sure that thyroid is good and the prolactin and just a basic blood count. And of course, if someone is bleeding very, very heavily, then I also add on a bleeding profile, because sometimes patients have undiagnosed bleeding disorders and they are bleeding really heavily. They just think, oh, this is normal, it's my period. But then they actually have like an actual disorder that needs to be taken care of.
So that's important to make sure you're looking at other causes, and we're not just kind of treating symptoms without understanding what's going on.
Exactly. And I think that's one of the challenges in today's healthcare space. Quick appointments, 5-10 minutes. You're kind of putting a Band-Aid on the issue, but then somebody really does need to dig in deeper and see, okay, is there something else that could be a little bit off that's causing some of this? And as we know, especially in young teens and young women, psychosocial aspect, right? So there's the medical aspect, but sometimes your pain and your anxiety and your depression can be amplified by other things that are going on. So taking the time to also talk about, okay, what is your support system like, is very, very important to me.
Right. So that stress management piece is really vital. And you specialize in fibroids as well. And so could you talk a little bit about that? Like, what is a fibroid? How does a woman know if she has them? And what's the link with PMS, PMDD, mood changes, heavy bleeding? Could you share a bit more about that?
Yeah, absolutely. So fibroids are benign tumors or masses of the smooth muscle that grow in your uterus. So they're made of the exact same material as your uterus, uterine wall. They're smooth muscle, and they're little balls that can grow inside the uterus, in the wall of the uterus, or outside the uterus. And a lot of times they don't cause any symptoms, and many women may not even know they have them. But sometimes they can cause very, very heavy bleeding. They can cause pain, and they can also impair fertility. So patients will have recurrent miscarriages or unable to get pregnant because of a large fibroid. And so if you are experiencing any of those symptoms, the best test to do is just a simple pelvic ultrasound. It's no radiation. It's a quick test. It's an imaging study that looks at your uterus and your ovaries, and they'll be able to see fibroids. And if you do have fibroids, especially along the bleeding piece, that can really affect PMS and PMDD, because women are bleeding through several pads or tampons, unable to go to work, bleeding through their clothes, kids not being able to participate in their sports or different teams. So it can just amplify all of that. So if you're someone who's having those symptoms, definitely getting screened and making sure you don't have a fibroid is definitely important.
Well, Dr. Cheruba, this was really helpful. You provided so much great information. If people want to work with you, how can they find out more about you?
Yes. So as you mentioned before, I just opened my private practice in Lafayette, California, here in the Bay Area. And so happy to see patients in person or televisit for all things GYN. In my practice, I do management of heavy bleeding, abnormal bleeding, PCOS, all types of birth control. And my two niches, I would say, are fibroids and menopause. So I am a nationally certified menopause practitioner as well through the North American Menopause Society. So definitely helping women through that transition hormonally and just life-wise, just a lot going on there. But also surgically with patients who are dealing with fibroids and who are experiencing bleeding, pain, and reduced fertility. So you can find me here in Lafayette. I am the fibroid doc across all social media platforms, so Instagram, TikTok, and YouTube. You can also join my email list, which you can do right through my website, lamorindagyn.com.
Excellent. Thank you. And so we'll put all of those links in the video description below so people can check them out. Thanks again for joining me today and for sharing this knowledge.
Thank you so much for having me. This was great. Really appreciate it.